This video is for healthcare professionals to review how to prepare and administer a single dose of octreotide acetate injectable suspension and some helpful tips for achieving reconstitution. Octreotide acetate powder and solvent is a long-acting suspension for injection for deep intramuscular injection and should only be administered by a trained healthcare professional. Each dose of octreotide acetate is provided in an injection kit that contains 1 vial containing octreotide acetate powder for injectable suspension, a pre-filled syringe containing the solution for reconstitution, 1 vial adapter for drug reconstitution, 1 1.5-inch 19-gauge safety needle. Before injection, you must reconstitute octreotide acetate using the solution in the pre-filled syringe provided. Please note that successful preparation and administration of octreotide acetate for injectable suspension relies on proper suspension technique. Remove the octreotide acetate for injectable suspension kit from refrigerated storage. Do not open the kit or try to speed up the warming process. It is essential to start the reconstitution process only after the injection kit has reached room temperature. Allow the kit to sit for a minimum of 30 minutes to reach room temperature. Please note, the kit can be left out for longer than 30 minutes before reconstitution, but do not exceed 24 hours. The injection kit can be re-refrigerated if it has been left out less than 24 hours. Before moving to the next step, place the vial on a hard surface and tap gently so that all of the powder is sitting at the bottom of the vial. Once the kit has reached room temperature, remove the plastic cap from the vial and clean the rubber stopper of the vial with an alcohol wipe. Peel the blister packaging and remove the vial adapter by holding it between the white lure cap and the skirt. Make sure not to touch the tip of the adapter. Place the vial on a flat surface, such as a countertop. Hold the vial adapter packaging and position the vial adapter on top of the vial and push it fully down so that it snaps in place, making an audible click. Once the adapter is in place, clean the tip of the vial adapter with an alcohol wipe. Peel off the outer syringe label. Inspect the syringe to ensure there are no visible particles. Snap off the smooth white cap from the syringe pre-filled with diluent solution and screw the syringe onto the vial adapter. Once the syringe is attached, slowly push the plunger all the way down to transfer all the diluent solution in the vial. After the solution is transferred to the vial, it is essential to let the vial stand for a minimum of 2 minutes, but no longer than 5 minutes. This will ensure that the diluent has fully saturated the powder. It is normal if the plunger rod moves up, since there might be a slight overpressure in the vial. During this time, prepare the patient for injection. After the saturation period, make sure that the plunger is pushed all the way down in the syringe. Keep the plunger pressed and shake the vial moderately in a horizontal direction for a minimum of 30 seconds, so that the powder is completely suspended, forming a uniform, milky suspension. If you see any granules or particles indicating that the solution is not completely suspended, repeat moderate shaking for another 30 seconds. The octreotide acetate suspension must only be prepared immediately before administration. Turn the syringe and vial upside down. Slowly pull the plunger back and draw contents from the vial into the syringe. Then unscrew the syringe from the vial adapter, and your dose of octreotide acetate is ready to be administered. There are 3 critical actions in the reconstitution of octreotide acetate: Not following them could result in failure to deliver the drug appropriately. First, the injection kit must reach room temperature before reconstitution. Remember to remove the injection kit from the fridge at least 30 minutes before reconstitution, but do not exceed 24 hours. Second, after adding the diluent solution, ensure that the powder is fully saturated by letting the vial stand for 2 to 5 minutes. Finally, after the saturation period, shake the vial moderately for a minimum of 30 seconds until a uniform suspension is formed. Prepare the injection site of the left or right gluteus with an alcohol wipe. Screw the safety injection needle onto the syringe. If immediate administration is delayed, gently reshake the syringe to ensure a milky uniform suspension. Pull the protective cover off the needle. Gently tap the syringe to remove any visible bubbles and expel them from the syringe. Proceed immediately to the next step for administration to the patient, as any delay may result in sedimentation. Octreotide acetate for injectable suspension must be given only by deep intragluteal injection into the left or right gluteal muscle, and never intravenously or subcutaneously. Insert the needle fully into the left or right gluteus at a 90-degree angle to the skin. Once inserted, slowly pull back the plunger to check that no blood vessel is penetrated. If a blood vessel is penetrated, reposition the needle. If inserted correctly, depress the plunger with steady pressure until the syringe is empty. Then withdraw the needle from the injection site and activate the needle safety guard. Activate the safety guard over the needle in one of two methods. Either press the hinge section of the safety guard down onto a hard surface, or push the hinge forward with your finger. An audible click confirms the proper activation. Record the injection site in the patient record. Remember to always alternate the injection site monthly. Dispose of the syringe immediately in a sharps container. Dispose of unused products or waste material in accordance with local requirements. Please read the instructions for use in the accompanying full prescribing information. Indications and usage. Octreotide acetate for injectable suspension is indicated for patients in whom initial treatment with octreotide acetate injection has been shown to be effective and tolerated for long-term maintenance therapy in acromegalic patients who have had an inadequate response to surgery and/or radiotherapy, or for whom surgery and/or radiotherapy is not an option to reduce GH and IGF-1 levels to normal. Long-term treatment of the severe diarrhea and flushing episodes associated with metastatic carcinoid tumors. Long-term treatment of the profuse watery diarrhea associated with VIP secreting tumors. In patients with carcinoid tumors and VIP secreting tumors, the effect of octreotide acetate injection and octreotide acetate for injectable suspension on tumor size, rate of growth, and development of metastases has not been determined. Important safety information. Warnings and precautions. Gallbladder abnormalities may occur. There have been post-marketing reports of cholelithiasis, gallstones, resulting in complications, including cholecystitis, cholangitis, pancreatitis, and requiring cholecystectomy in patients taking octreotide acetate for injectable suspension. Patients should be monitored periodically. If complications of cholelithiasis are suspected, discontinue octreotide acetate for injectable suspension and treat appropriately. Glucose metabolism. Hypoglycemia or hyperglycemia may occur. Blood glucose levels should be monitored when octreotide acetate for injectable suspension treatment is initiated or when the dose is altered. Anti-diabetic treatment should be adjusted accordingly. Thyroid function. Hypothyroidism may occur. Baseline and periodic assessment of thyroid function, TSH, total and/or free T4, is recommended. Cardiac function. Bradycardia, arrhythmia, Conduction abnormalities and other electrocardiogram changes may occur. The relationship of these events to octreotide acetate is not established because many of these patients have underlying cardiac disease. Use with caution in at-risk patients. Nutrition. Octreotide may alter absorption of dietary fats. Monitoring of vitamin B12 levels is recommended during therapy with octreotide acetate for injectable suspension. Patients on total parenteral nutrition, TPN, and octreotide should have periodic monitoring of zinc levels. Drug interactions. The following drugs require monitoring and possible dose adjustment when used with octreotide acetate for injectable suspension: cyclosporin, insulin, oral hypoglycemic agents, beta blockers, and bromocriptine. Octreotide has been associated with alterations in nutrient absorption, so it may have an effect on absorption of orally administered drugs. Drugs mainly metabolized by CYP3A4 and which have a low therapeutic index should be used with caution. Octreotide should be discontinued at least 4 weeks prior to lutetium Lu-177 dotatate dosing due to competitive binding to somatostatin receptors. Adverse reactions. In acromegalic patients, the most common adverse reactions occurring in patients receiving octreotide acetate for injectable suspension were biliary abnormalities, 52%, diarrhea, 36%, abdominal pain or discomfort, 29%, flatulence, 26%, constipation, 19%, headache, 15%, and anemia, 15%. In carcinoid tumor and VIP-secreting tumor patients, the most common adverse reactions occurring in patients receiving octreotide acetate for injectable suspension were biliary abnormalities, 62%, injection site pain, 20% to 50%, nausea, 24% to 41%, abdominal pain, 10% to 35%, fatigue, 8% to 32%, headache, 16% to 30%, hyperglycemia, 27%, back pain, 8% to 27%, constipation or vomiting, 15% to 21%, dizziness, 18% to 20%, sinus bradycardia, 19%, pruritus, 18%, upper respiratory tract infection, 10% to 18%, myalgia, 4% to 18%, flatulence, 9% to 16%, arthropathy, 8% to 15%, rash, 15%, generalized pain, 4% to 15%, sinusitis, 5% to 12%, conduction abnormalities, 9%, hypoglycemia, 4%, and arrhythmia, 3%. Please see the full prescribing information. Thanks for watching.